Om Swastiastu, greetings to evaluators and facilitator. We are from small group discussion B3. We would like to explain about our student project. The topic is water-soluble vitamin in irritable bowel syndrome. Here are our members that participated in the making of this student project. Let's start with chapter 1, introduction.
Hello, my name is Dewa Prema Shanti, and in this occasion, I would like to explain chapter 1 introduction. And my student ID number is 004. First is background information. Gastrointestinal disease are one of the common health problems that are experienced by the world community. In the United States, it is estimated that 11% of the population has experienced chronic gastrointestinal problems, and the increasement in a straight line to its increasement. And one of the example of gastrointestinal disease is irritable bowel syndrome. Irritable bowel syndrome, or commonly called IBS, is a collection of symptoms due to irritation of the digestive tract. The prevalence of IBS is around 5% to 11%, and it is the most common gastrointestinal function problem. The symptoms that generally appear in IBS are abdominal pain, diarrhea, constipation, and bloating with higher risk factor experienced by women. One of the specific causes that are often associated with the incidence of IBS symptoms is the consumption of certain food and beverage, especially water-soluble vitamin, and this is further proved by several literature that show a significant relationship between the severity of IBS symptoms and the intake of vitamin D. Vitamin D is a type of water-soluble vitamin, and in addition to vitamin B, there is one more water-soluble vitamin, namely vitamin C. So based on this statement and seeing the association between water-soluble vitamin and the incidence of inflammatory bowel syndrome, or IBS, our group is interested in making a student project with the title Water-Soluble Vitamin in IBS. Okay, next.
Thank you for the time given. My name is Gusti Adityawarnam with the student number 200251125, here to continue with the problem formulation in this student project of ours. There are 5 points here. One is, what is the definition of IBS and water-soluble vitamins? And second one is, how are the digestion and the absorption of the water-soluble vitamins? And three, what are the recommended dietary allowance of water-soluble vitamins? And four, what is the possible risk of IBS related to the water-soluble vitamins? And five, how is the IBS treatment approach especially related to the water-soluble vitamins? Next up, we have the purpose of making this student project as well. There are 5 points as well. The first off, to know the definition of IBS and water-soluble vitamins, to understand digestion and absorption of the water-soluble vitamins, and then to know the recommended dietary allowance of water-soluble vitamins, to know the possible risk of IBS related to the water-soluble vitamins, and to understand the IBS treatment approach, especially related to water-soluble vitamins. Lastly, in this first chapter is about the benefit. So the benefit of writing this paper for medical students and for the communities to enhance the understanding and knowledge about IBS and its relation to water-soluble vitamins. These contents intend to amplify the understanding of the definition, digestion, and absorption, RDA, possible risk, and treatment approach of IBS and its relation to water-soluble vitamins. In addition, this student project is also expected to be a reference for other research related to IBS and its relations to water-soluble vitamins. That's all from me. Thank you.
Hello everyone, my name is Angelique Cynthia. The last 3 digits of my student ID number is 068. Now I would like to explain about chapter 2 discussion. 2.1 definition. We are going to talk about water-soluble vitamin. Vitamins, along with minerals, are known as micronutrients. It is essential for a variety of body activities and in maintaining health. Individuals usually take vitamin or mineral supplements to promote health and or to prevent and minimize illness. There are two types of vitamin. The first one is fat-soluble vitamin. It is retained in fat after absorption, including vitamin A, D, E, and K. And then the one we are going to talk about is water-soluble vitamin. It is dissolved in water, making it not easily to stored in the body. It is including vitamin B complex. There are 8 vitamin B that we know, and vitamin C. The next slide will be presented by my friend. Thank you.
Okay, my name is Ananda Raharja with last 3 digits of student ID numbers 136, and I will continue to the function of water-soluble vitamin. So the first one is vitamin B1 or thiamine. It is cofactor in the breakdown of glucose. And then vitamin B2 or riboflavin. It is cofactor in redox reaction. And then vitamin B3 or niacin. It is coenzyme in the transfer of hydrate ion. And then vitamin B5 or pantothenic acid. It's for energy production and formation of hormones. And vitamin B6 or pyridoxine. It's for coenzyme and production of red blood cell. And then vitamin B7 or biotin. It's for protein, fat, and carbohydrate metabolism. And then vitamin B9 or folate. It's for synthesis of purine and pyrimidine. And then vitamin B12 or cobalamin. It's for coenzyme and metabolism. And last one, vitamin C or ascorbic acid. It is reducing agent in enzymatic reaction and non-enzymatically. Okay, maybe that's all for the function of the water-soluble vitamin. The next slide will be continued by my friend. Thank you.
Hello everyone, my name is Bagus from Saputra, and I will continue the presentation in 2.1 definition of IBS. So IBS or irritable bowel syndrome is a disorder of the bowel related to the chronic or recurrent abdominal pain accompanied by easing or worsening with defecation or bowel habit change. In room 4 definition of IBS, which is the newest one, symptom chronicity greater than 6 months and current activity present within 3 months. The second one is symptom frequency, at least 1 day per week, and requires having abdominal pain related to defecation.
Greetings, my name is Felix. Now I'm going to explain about the method of journal searching. Searching literature or journals requires a lot of consideration. The content included in the review should be widely distributed across multiple multidisciplinary databases. Problems such as indexing, ambiguity of terms, and limited abstract content result in decreased sensitivity for primary subject searches. Advanced techniques such as reference tracking and citation searching are minimal but productive, resulting in unique and high-quality reference for inclusion in systematic reviews. Further research could determine whether peer culture is more suitable for topic areas where terms are well defined. Indexing is consistent and literature dissemination is limited to a limited number of databases, or it can be used as a precursor to conventional subject searches with a scattered topic to determine research utility. Evidently, various search techniques are needed to identify the literature roughly. It is a case of compromise on the sensitivity of primary search strategy while supplementing this with additional search techniques to identify other references. The need for further investigation and comparison of these different techniques is indicated. That's all from me. Thank you.
Hello, my name is Raharja with my last 3-digit ID number 156, and I will be presenting the digestion and absorption of water-soluble vitamins. Water-soluble vitamins can be obtained from endogenous and exogenous sources via intestinal absorption. The first one, vitamin B1 or thiamine, is coenzyme in carbohydrate metabolism. B1 deficiency may cause beriberi. Vitamin B2 or riboflavin is coenzyme in redox reaction. B2 deficiency may cause mouth and eye inflammation. Vitamin B3 or niacin is also coenzyme in redox reaction, and B3 deficiency may cause pellagra. Vitamin B5 or pentatonic acid is for coenzyme A synthesis, and B5 deficiency may cause adrenal insufficiency. Vitamin B6 or pyridoxine is coenzyme in amino acid and glycogen synthesis, and B6 deficiency may cause central nervous system disorders. Vitamin B7 or biotin is coenzyme in protein, fats, and carbohydrates metabolism. B7 deficiency may cause dermatological abnormalities. Vitamin B9 or folate and vitamin B12 cobalamin are both essential for nucleic acid metabolism and red blood cell formation. B9 and B12 deficiency may cause anemia. Vitamin C is needed for mucous membrane maintenance and collagen formation. Vitamin C deficiency may cause scurvy. Maybe that is all from me. Next slide will be presented by my friends. Thank you.
Okay, hello doctor and hello everyone. Before I continue explain about the presentation, let me introduce myself first. My name is Angelina Vinsanuta Serda with the last 3 digits student ID number 170. On this occasion, I will going to continue explain about the RDA from 2.4 point. So the first one, we have vitamin C, where we can get it from fruit and vegetable, and the RDA is approximately 68 milligram for a day for adult. And the vitamin B, and the next one we have vitamin B1, where we can get it from unrefined cereal grain, organ meats, meat seeds or nuts, and the RDA is varied. The next one is vitamin B2, where the starches is from animal protein like meat, fish, and poultry, and the RDA is 0.6 milligram for healthy people and 1.2 milligram in adult. And also we have vitamin B3, where the RDA shows 6.6 NES per 1000 kilocalorie, and the last one is vitamin B5, where the RDR sources is from animal tissue, whole grain cereal, and legumen, and the RDA is for infant is 2 to 3 milligram, and for adult 4 to 7 milligram. Well, that's all from me. The next point about vitamin B6, B7, B9, and B12 will be explained further by my friend, and thank you for your attention.
Thank you for the chance. My name is Trifena Lisanias. With the last 3 digits of student number is 119. Now I will continue the presentation about recommended daily allowance of the water-soluble vitamins. I will start from vitamin B6 or pyridoxines. It is found mostly in chicken, fish, organ meats, pork, and eggs. The recommended daily allowance of vitamin B6 is 0.016 milligram per grams per day. For vitamin B7, it found mostly in liver, yolk, soy flour, cereals, and yeast. The recommended daily intake is approximately 60 micrograms per day for adults. And vitamin B9, the recommended daily allowance is different for adult males and females. For adult males, the recommended daily allowance is 200 micrograms. For adult females is 180 micrograms per day. And lastly, the vitamin B12, it can be found mostly in animal products, and the recommended daily allowance is 2 micrograms. That's from me and Eva. The presentation will be continued by
Hello, my name is Anggi Triana Devy with last 3 digits of student ID number are 088. I will continue the presentation about possible risks related to water-soluble vitamin in IBS. Vitamin is important in the human body because it is one of the essential compounds to keep human body in optimal health. There are 2 kinds of vitamin, which are fat-soluble and water-soluble. Water-soluble vitamins include vitamin B complex and vitamin C. Deficiency in water-soluble vitamin could lead to some possible risks in IBS. For example, deficiency in vitamin B6. Low consumption of B6 could stimulate the inflammation in IBS by making imbalance in anti-inflammatory and pro-inflammatory interleukins that will lead to increasing of symptom severity. Other than that, vitamin B12 deficiency could lead to decreased production of serotonin and lower activity of histamine neutralizing enzyme, and leading to greater sensitivity to histamine in food, where these are more common happening in IBS constipation. Other than vitamin B, vitamin C are also included in water-soluble vitamin. One of the possible risks that may happen in vitamin C deficiency is scurvy. A low serum of vitamin C level could lead to scurvy in patients with IBS. Okay, that's all from me. Next will be continued by my friend. Thank you.
Hello, my name is Putu Yudhistira Kawardana with real student ID number is 098 and I will continue the presentation. So I'm gonna present about the water-soluble vitamin approach for IBS treatment. The first thing is the vitamin B. So there are links between exaggerate symptom and insufficient vitamin B6 intake in patient with IBS. Pyridoxal phosphate 6 isoprenyl 2,4-disulfonic acid, P2X receptor antagonist, and vitamin B6 derivative can improve bowel movement, alleviate stomach pain, and reduce visceral hypersensitivity. Vitamin B6 can also help to restore the pro-inflammatory and anti-inflammatory balance, and then preventing inflammation and reducing its intensity. Vitamin B6 should be consumed at a rate of 1.6 milligrams per day for men, and for women it's 1.2 milligram per day. Vitamin B6 as well as folate and vitamin B12 have significant function. It can boost cellular metabolism, and vitamin B12 is absorbed in the distal ileum, while folates are absorbed in the duodenum and proximal jejunum. The next thing is vitamin C. Vitamin C has been shown to help people with IBS too, particularly those who suffer from constipation type of IBS. According to the expert, the patient are recommended to consume either buffer vitamin C powder or effervescent vitamin C powder. A buffer vitamin C is a vitamin C that has been mixed with potassium and magnesium and dissolved in a glass of water and should be consumed on an empty stomach. Meanwhile, effervescent powder is made by dissolving vitamin C with magnesium carbonate in a glass of water too. And in 30 to 90 minutes, the effervescent powder of vitamin C can induce the bowel movement. I think that's enough from me. The presentation will be continued by my friend. Thank you.
Hello, my name is Ketut Adelia Febrianti Puspa Devi. With the last 3 digits of my student ID number is 041. So I will continue the presentation with the last chapter, which is the conclusion. Okay, for the conclusion, irritable bowel syndrome, or commonly called IBS, is a collection of symptoms due to irritation of digestive tract, including chronic or recurrent abdominal pain, accompanied by easing or worsening with defecation or bowel habit change. One of the specific causes that are often associated with the incidence of IBS symptoms is the consumption of certain foods and beverages, especially water-soluble vitamin. Deficiency in water-soluble vitamin could lead to some possible risks in IBS, such as deficiency vitamin B6 is related to inflammation, deficiency vitamin B12 that lead to greater sensitivity to histamine inputs, and the last one, deficiency vitamin C because of restricted diet of IBS therapy. Therefore, some water-soluble vitamin approach that can be taken for IBS treatment are consumption of P2X receptor antagonist and B6 derivative, or intake of vitamin B6 and B12, as well as folate for vitamin B deficiency. Meanwhile, consumption of either buffered vitamin C powder or effervescent powder are recommended, especially constipation type of IBS. So here are some references that we use for making this student project. That's all from our student project. We apologize if there is a mistake in making this student project. Thank you.